Thank you, Chair. Let's talk about ARPA-H for a little bit. This, for people who've not been thinking about it, it's an idea the President has to take the long experience with DARPA, Defense Advanced Research, which is different than the way we've done basic health research. And in those instances where we can work toward a rapid conclusion and a more hands-together partnered way to do that, I'm for that. Chair Murray has supported the approach of trying to get there quickly. She and Senator Burr have introduced legislation to codify this concept. I really want to ask two questions here. And one is, talk a little bit about your decision to structurally put ARPA-H under the NIH umbrella, but directly reporting to you, and then we'll come to the spending decision later.
Senator, thank you for the question and the support you've provided to ARPA-H. ARPA-H, at the end of the day, is like NIH, an agency that takes that research. But how it differs from NIH is it wants to be able to launch from the pad very quickly, and working in partnership with the private sector, those innovators that are out there, the biomedical scientists, be able to actually give the American people a product quickly. And that's why we want ARPA-H to be more nimble, more facile, and have the opportunity to break away from the tethers of governance that you see in NIH to be able to launch as quickly as possible. We believe we're going to be able to do that while using the efficiencies that NIH has. So, for example, starting up your human relations office, your payroll office, your accounting office, rather than have ARPA-H have to start from very scratch, make use of what NIH provides, but give them the autonomy to launch the way they think fit.
And at ARPA-H, I think, as I've heard that discussed, while all of those assets would be there, the umbrella agency of NIH, the ARPA-H system would not necessarily work like the NIH system. You'd have ability to bring people in for shorter periods of time, understanding that this is a project, we're bringing you in to work on it, and at the end of, say, 3 years, we expect this project to be done, and you'll have the ability to go on to some other work somewhere else. Is that sort of your understanding of this as well, Secretary?
That's correct. It will not work the way NIH works. It will work much closer to what you understand to be the way DARPA works in the Department of Defense.
Mm-hmm. I do think that NIH showed during COVID with RADx and with some of the warp speed involvement that even NIH had, but particularly with RADx, the ability to do things in a different way. But I think look at how that worked and how DARPA works, and figuring out how they all work together would be a good thing. So Senator Murray and I, working together on this committee for 7 years, have increased the NIH funding by more than 50% after a decade with no real increase. It's been an important goal that we've worked on together. The concern at NIH about ARPA, or the NIH advocates, not necessarily the people working there, but the support groups and advocates of ARPA-H has always been that it would take money that otherwise would go to NIH. It appears that that's exactly what's happening here. We did $1 billion for startup money for ARPA-H last year. This budget proposes another $4 billion for ARPA-H and zero for NIH. I'm confident that based on our past working on this topic, zero will not be the number we come up with. But why did you submit zero as opposed to an increase in NIH and money for ARPA-H as well?
Appreciate the question, and to explain. When the President asked us to submit our budgets to Congress, we had to work with the baseline that we knew that was in front of us. At that point, Congress had not completed the work on a fiscal 2022 budget. And so we had to operate expecting that our baseline would be the continuing resolution, which is far lower than what you ultimately passed in the omnibus bill for 2022. Certainly now, knowing what the omnibus bottom line is for NIH, we will work using that bottom line to talk about increases for NIH. So we look forward to working with you to make sure that NIH continues to receive the robust funding that it has always received from Congress.
Let's talk about mental health for just a little bit. I was pleased in the budget. You've shown asked for a substantial increase in the certified community behavioral health centers, allowing them to continue to treat mental health like all other health, and also making the current demonstration program permanent and allowing all the states and territories to participate. So I'm pleased to see that. I look forward to seeing how far we could go to create a reality of that request. One thing I did want to talk to you about with the mental health agency, SAMHSA, the budget was released on March 29th. 3 weeks later, we got the first of two notices of a fairly substantial reorganization, three reorganizations. One established a new Office of Recovery within the Office of the Assistant Secretary. Another created an Office of 988, which is the suicide helpline number, Behavioral Health Crisis Coordination. A third established a new program of prevention initiative. We have several concerns here. One is there's nothing in the budget that reflects these agencies being there, or so far no direction as to where money should come from to fund them. Two, I think some of the prevention efforts have become more harm reduction efforts than I think the Congress would have intended for, or certainly that I would intend for. And three, there are even press reports that the administration's thinking about safe injection sites under the guise of prevention, even though I believe those sites are against the law. Now, we did have an update just yesterday, the first update of our staff of what that Office of Prevention might do. And we asked about some of these controversial things. I think we're not at all sure yet that there's enough information out there to not be concerned about this or not stay fully engaged. One, why would we get that kind of reorganization 3 weeks, and only 3 weeks after the budget was submitted? And two, how do you expect us to incorporate this into the budget that you've already asked for?
Senator, thanks for the chance to respond. And as I mentioned to you previously in a conversation, we would reach out to your team. We have reached out to your team. Let me tell you what my team is explaining to me. First, the reorganization does not impact the budget. We're going to work with the monies that we have. We don't need new authorities, because what we're simply doing is reflecting the president's priority on behavioral health to really tackle this, and also to focus on trying to have a new strategy on drug use. And so what these offices are doing is essentially consolidating what exists in our agencies to really focus in more directly on these very important subjects. And so what we can do is we'll follow up again with your team to give you details. As I said, it doesn't impact the budget, and what we can do is explain how the reorganization helps us achieve the president's desire to really tackle mental health and drug use as directly as we can. We established, for example, a coordinating council among all of HHS's agencies so that we wouldn't wait to learn what each other is doing. SAMHSA and the Office of Public Health are coordinating that, so we're working immediately to deal with mental health. And so we're going to do more of that so we can make the best use of our money, but we'll follow up.
Well, we need you to do that, and it will impact the budget to the extent that we need to know where that funding comes from and what new lines need to be created for that reorganization if there need to be new items, and we look forward to continuing to work with you on that.
Thank you.
Thank you, Chair.